Welcome to the Australia-India Institute's first podcast for the year as part of a series with leading researchers, experts and academics on issues pertaining to the Australia-India relationship. My name is Lisa Singh and I'm the Chief Executive Officer at the Australia-India Institute. And today I'm joined by Professor Nathan Grills, and we'll be discussing the impact of COVID, particularly the Omicron variant, on both India and Australia and the broader Asia-Pacific region. I'd like to start by acknowledging the traditional owners of the land, the Gadigal people of the Eora Nation, and pay my respects to their elders past, present and emerging. So first, to introduce Nathan. Nathan's involvement in global health spans some 20 years. He obtained a Master's and Doctorate of Public Health from Oxford University under a Rhodes Scholarship, and is a Fellow of the UK and Australian Faculties of Public Health, as well as one of our most valued resident fellows here at the Australia-India Institute. Nathan's research expertise is in the area of non-communicable diseases, disability inclusion, community health, primary healthcare systems, and understanding faith-based development agencies and programs. Nathan has worked extensively in India and developed partnerships with leading Indian institutions such as the Public Health Foundation of India, CMC Vellore, Catholic Health Association of India, and the Emmanuel Hospital Association. So welcome, Nathan.
Thank you, Lisa. It's great to be able to chat this morning.
So look, in November last year, I understand you went to India and things were pretty much, well, almost back to normal after the Delta variant of COVID at that time. And then of course, Omicron has happened since. So what is Omicron doing and what do we know about Omicron in India?
Yeah, that's a really good question, but a hard one to answer. It's constantly changing, as everyone is aware. So the answer I give you now, probably in 3 days, will be wrong, but I can give you an update as I understand it now. Omicron may be a really good thing. It could be an answer to prayer, in that it may be less severe. It seems it's very highly transmissible, and hopefully it may even displace the more dangerous Delta variant. So there's some potential to be a good thing. But when you get a high transmissibility and many people infected, there's also a risk that a small percentage of those people end up in hospital. And because you have so many people infected at one time, it can stress the whole hospital system, and that's what we're fearing in India and in Australia. But right now, the figures show that it's up to 85% asymptomatic. So a lot of people don't even know they've got it. And they're saying, some of the modelling is saying it's up to 90% less severe, which is really good news. We also know that the vaccines seem to work against Omicron, at least to stop people getting severe infection. There's also, in India, there's a very high level of natural immunity from last year, and that provides about 60% protection. If you've had a previous infection with Delta, then you're 60% less likely to even get Omicron this time around. So yeah, we're doing some models, and I've obviously looking at the international literature around what might happen in the next few months. It does seem that it's about 1/5 as dangerous in India currently, and we're estimating that the hospitalizations and ICU admissions will be about 1/5 of what it was during the peak last year, which is reassuring given the huge, devastating wave that happened in April, May, June last year.
That's much more reassuring than last year. But I guess that this is where the role of vaccines comes into play. So in relation to this variant of Omicron, what role do vaccines play? And I mean, given your expertise on the whole Asia-Pacific region as well and the health sector there, particularly sort of the impact of COVID and vaccination accessibility in our region, how is that current rollout going of vaccines across the region? And, are they going to be increasingly important in relation to Omicron?
Yeah, I think just to reinforce that vaccines are very important to stop severe disease and hospitalization. It's worked very effectively against Delta, and it's seemingly going to work effectively against Omicron to stop severe disease and hospitalization. We do know that the vaccines, the protection wanes over time, and also that the vaccines aren't as effective against Omicron as they are against Delta and previous variants. So yeah, so we do know though that a booster is very effective at getting the protection back up towards 88%. So if you've had a booster recently and you've had the 2 primary doses, then it's 88% effective at stopping severe disease, which is really reassuring. But the issue is there, the boosters are really important. Without a booster, it seems there's very little protection against spread of Omicron, but there is still protection against hospitalization, but it's only about 50 to 60%. So the booster is really important. But the boosters are an issue because in low middle income countries, a lot of people have not even received their initial course of COVID vaccination. So, is it right to be boosting when we're potentially decreasing the ability to vaccinate people who haven't even had a primary course? That's an ethical question for the international community, given there was a commitment of last year of 2 billion vaccine doses for low middle income countries through the COVAX facility, but only about 1/4 of those were delivered last year. So out of the 7.8 billion doses of vaccines have been given, which is a miracle in 1 year, after, nearly 2 years after the actual epidemic started, that we can have so many vaccines given. But of those, only 1/4 of those are given in low middle income countries. So it's very inequitable. Looking at India, India's been a great example of mass production of vaccines. They were producing huge amounts of vaccines, up to 300 million vaccines a month in India. So lots of doses. India's done very well in its vaccination program. About 65% of adults are fully vaxxed. That leaves a lot of people who are not vaccinated still, and still much more vulnerable because of that. And that's where the challenges for India lie, in it's a low vaccination rate in the younger people. They've just started their 15 to 18-year-old vaccination program. And they've only just started this week as well their booster, or they're calling it a precautionary dose, the 3rd dose. So that means that healthcare workers and frontline workers and others may not be fully protected because they haven't had the booster yet. And they're now doing a program, they'll be doing it very quickly, rolling it out to try and boost particularly frontline workers and healthcare workers and high-risk groups.
I mean, I think this, as you touched on, it really is an ethical question in terms of how, we are in Australia all sort of lining up to get our booster, and yet we're living in a region where only 1/4 of those in developing countries have been vaccinated. And, India's efforts have been incredible. If you think of the size of the population, 65%. But I think still there's a long way to go when you think about the youth of the India population as well, still only just starting to get theirs. So lots more work to do. But I guess with this current spike that we're seeing with Omicron, both here in Australia, obviously, and now also in India, starting to sort of get to its peak. How do the sort of numbers compare, between India and Australia in relation to Omicron? Are there similarities there in terms of the spike, or how do we fare?
Yeah, and just to go back to your last point, India has also contributed significantly to vaccine doses being given in low middle income countries, and their production has helped other countries to be able to give vaccines. But back to looking at the current numbers in India and Australia, they actually parallel each other very similarly, not the total number because India is so much bigger, but the rate is very similar in India and Australia right now. So the rate of infection in India is about 0.075, which is just numbers, but basically that's the same rate as Australia. So India yesterday had about 2.5 lakh, so 250,000 cases reported yesterday. But in reality, it's about probably 20 to 30 times higher than that because it's very low testing and a lot of the cases are asymptomatic, so they're not even picked up. And that's similar in Australia right now. We had about 100,000 cases on average in the last 4 or 5 days. And again, it's much higher than that. We're only testing a small percentage. We know that because our positivity rates of what we do test are up anywhere between 15 to 25% in Australia, and India's about 10% of their cases they're testing are positive. So it means that the waves are actually in parallel right now. We may see the peak. The question is when everyone's asking is when does the peak come? That will determine,
yeah,
yes, when we get back to more normal life and when it starts to subside, this current wave. It's India, like Australia, there's no one India, there's no one Australia right now. It's very different in New South Wales versus Victoria versus Western Australia. In Australia, so New South Wales and Victoria will peak much earlier than other states, and Western Australia, which hasn't opened up yet, may be a long way off peaking. That's the same in India, where, you know, in Mumbai and Delhi, very high numbers, but the country as a whole, in rural areas particularly, hasn't really been touched by Omicron yet. So you're going to get a wave that's sort of ongoing in different areas, or a number of waves coming and going. But if you look at the waves in terms of the bigger cities, the metros, and the average, they're saying that in Delhi and Mumbai, for example, that the peak might happen this week, which is great news. And the same in New South Wales and Victoria. They're saying the peak is probably this week. Even the estimates are saying the same day, interestingly. But the peak in different areas of Australia and different areas of India will take some time, and the average for the peak is probably going to be just before Australia Day and Republic Day. So hopefully by then we can be celebrating the fact that Omicron is decreasing. But again, these are all estimates and things are changing from day to day, so it's hard to be certain.
Yeah, look, I think it's definitely a watching space, but good to hear that data from you. And I think here in Australia, we're thinking, what does this all mean in terms of travel to and from India? So you got any predictions on that, Nathan? I know you were in India last November. That was obviously pre-Omicron. So when are you planning to go back?
Yeah, Lisa, I would love to go back as soon as possible. And when I was there in November last year, I was excited to see that India was going back to fully functioning, and it was, sort of leaving the pandemic behind. But, just a month later, in a very different position.
Yeah.
It shouldn't really, if Omicron does remain quite mild, it's still a severe disease when millions of people are getting infected, because many of those will have a bad outcome, end up in hospital. But if it does stay relatively mild, and there's large numbers of cases in India and Australia, international travel does remain quite safe, because everyone that travels, as you know, is getting a PCR test prior to departure, often on arrival. They're all vaccinated to be able to travel. So there's actually quite a low risk of someone coming into our country in Australia or into India with the virus. And that's actually a very small number of people. Even if one does come in with a positive Omicron, it's very small numbers compared to the numbers of infections that are happening every day in India and Australia. 240,000 at least recorded, but far many more than that. And they're all from domestic sources in India, and same in Australia with 100,000 cases or whatever, high numbers. They're all domestic cases. So the international arrivals don't add any more, or add very few extra cases to our caseload. So Australia doesn't have any quarantine currently coming from overseas, unless you're going to Western Australia. India currently has 1 week of home quarantine when you're going into India. That makes it difficult for people doing business if you have to have a week of home quarantine, or it makes it difficult if you're doing short trips. So I'm hoping we'll be able to travel in February, late February. It will depend on the government of India and how they see the pandemic wave playing out. If they're happy it's going down quickly, I think they'll remove that 7-day compulsory home quarantine. So stay tuned. But I mean, India's has obviously had such a bad situation last year, and they're rightly so being cautious. They don't want the same sort of mass casualties and mass numbers of infections happening like last year. So they've closed schools, some schools, and government offices and programs are all limited right now. So traveling to India right now, you wouldn't be able to do much, because lots of things are, especially government offices and so on, have closed down. But I'm hoping by middle of February, late February, that we'll go back. That offices will be back in the office, and travel will be once again allowed. But again, who knows? We're uncertain at this time, and we'll know better by the end of this month, I think, what that would look like.
That's really, really useful for people to hear, Nathan. And I think, just to conclude, if people want to know more about, how things are tracking between both countries, what is the best source of data for people wanting to travel between Australia and India?
Yeah, Lisa, I spend a lot of my time looking at different sources and trying to compare. The two or three that I found really useful, the Smart Traveller website in Australia, that's the smarttraveller.gov.au, that gives you information about traveling to other countries and how what the risk is in those countries and what are the requirements and restrictions in that country. On the India side, the Ministry of Health and Family Welfare, mohfw.gov.in, is useful information on COVID. And if you're traveling to India anyway, you have to go to the Air Savida portal, where you upload your vaccination certificate and so on. And that has very clear information, the Air Savida portal. And everyone going to India has to go to that portal anyway. So I'd advise you to look at that website. In terms of data and forecasts about how the wave is going to play out, I draw heavily on the IHME, International Institute for Health Metrics and Evaluation from Washington University. That has some very good data on trying to map or model the expected cases and deaths and the wave, how it's going to play out. There's many other modelling sites. That's one that I've used that I find quite accurate.
Fantastic. Well, Nathan, thank you for joining me today. And for those listening, Professor Nathan Grills from University of Melbourne, if you have any questions, please don't hesitate to find us on social media where this discussion will be posted and ask your questions. And we'll also put up some of those links that Professor Grills has shared with us today in terms of data and also best sources for travel between Australia and India. And we do hope that the peak will drop off and that we'll be back to travelling between both of our countries very soon. Thanks so much, Nathan.
Thank you, Lisa. Appreciate it.